Well, good afternoon, everybody. Nice to see you. Thanks for coming out. My name's Chris Pearson. I spent a good part of my career in this building, 14 years in the legislature, the last 6 as a senator, and it is great to be back. I'm proud to be part of a coalition launch today for something we call Vermont Healthcare 911. Vermont faces a healthcare crisis. To work through the challenge requires, in our opinion, an unusual and broad coalition, and that is what we are starting to build. We want to invite all Vermonters to join us. It will be our hope to promote a data-driven discussion, so let's get started. Over here we have an illustration of how Vermont healthcare costs impact Vermonters. We pay, by quite a substantial amount, the most for health insurance of any state in the country. This chart comes from the Kaiser Family Foundation, compares bronze level insurance rates from the marketplace. You can see Vermont has spiked in the last several years. Almost twice what our neighbors pay in Maine, 2.5 times what our neighbors pay in New Hampshire, and over 2 times what the country on average pays for health premiums. Vermonters know this, our business leaders know this, families know this because it hits them directly in the pocketbook. The question we're going to start to discuss is why. Why is this happening? We believe that hospital costs are a big driving force behind the rate you see in climbing insurance. So we'll look at this. This is a proportion here of general services salaries. It's public data comparing the proportion of salaries dedicated to general services, which you would think of as administration and oversight of hospitals, compared to peer comparators around the region and around the country. What we've done, and one has to do this if you're looking at healthcare data, and particularly hospitals, is compare apples to apples. You can't compare the University Medical Center to Rutland Hospital, for instance. They're entirely different. So what this has done, our comparators, is looked at 43 peer academic medical centers, for instance. And there you'll find University of Vermont Medical Center spending 71% of their salaries on administration and overhead. The competitors are spending 43%. And these are apples to apples comparison. These are hospitals chosen that represent similar population errors, similar discharge data, and similar revenue. Our small city hospitals compared to 20 peers, also compared along population, discharge, and revenue lines. Again, you see our smaller hospitals are spending a much higher proportion on general services compared to patient care. Our rural hospitals, our small community hospitals, fare much better actually, and are much closer to their peers. Heartening to see in our small communities. But this illustrates there is clearly room for improvement. And there is, we believe, potential for Vermonters to save hundreds of millions of dollars annually if we bring hospital budgets in line with peers. Let me be clear and say, we value our hospitals. We all have stories of people in our families or ourselves who've been well cared for. These are vital institutions for our healthcare and for our communities. But we need them to be well run. We cannot afford this to go unanswered, and now is the time to act. With that, I'm very proud to introduce Lisa Ventris, who's the co-chair of our Leadership Council, and turn it over to her. Thank you.
Thank you, Chris. Good afternoon. Thank you all for being here. As Chris said, I'm Lisa Ventris. I'm a longtime resident of South Burlington and a retired nonprofit executive. And it's my privilege to serve as co-chair of the Vermont Healthcare 911 Leadership Council, along with Governor Jim Douglas, and to have our colleagues join us here today. Vermont Healthcare 911 is a diverse coalition of business leaders, labor unions, healthcare professionals, and others who've come together to seek answers to the questions: why does Vermont's healthcare system cost so much? Why is Vermont so different from the rest of the country? And what can be done about it? These questions have been asked by many over decades, and some of us in the Leadership Council were around when the first healthcare coalition was formed in the early 2000s. In 2025, we have intentionally included 911 in our coalition's name because Vermonters are experiencing a full-blown emergency in the cost of healthcare. As Chris showed, the chart illustrates that Vermont's commercial insurance rates are the highest in the country and more than double the national average. Since 2018, health insurance premiums in Vermont have grown 92%. 92%. And since 2021, hospital costs have grown from 35% to 44% of Vermont's total healthcare spending. To be clear, we greatly value Vermont's academic medical center, our small city rural hospitals, and rural critical access hospitals, which serve as important assets in our communities. And as each of us can tell, we have experienced very powerful, positive experiences, either directly or our family members receiving wonderful care at these facilities around the state. We need our hospitals, though, to be healthy so that we, too, can be healthy. However, as you will hear from our coalition members, such high costs directly impact the profitability of businesses and drive up the costs of school and municipal budgets, which, as we have seen in recent years, have been frequently voted down multiple times in communities around the state. Furthermore, high costs greatly impact Vermont's affordability as a desirable place to live, work, and raise a family. And it increases the numbers of Vermonters who are uninsured or underinsured, which impacts our communities and healthcare systems up and downstream. Regardless of which data sources are cited, the narrative is the same. Vermont is in a state of crisis. The cost trends are undeniable and increasingly unsustainable. The time for action has arrived. Our goals are threefold: to challenge hospital leaders, the Green Mountain Care Board, the legislature, and the administration to accelerate their efforts to identify opportunities that rein in healthcare costs in Vermont and that move us closer to the national average. To leverage comparable data that helps us understand how Vermont's hospitals perform relative to their peers, so as to gain insights into strategies that improve cost controls, and to study success stories to benefit all hospitals. And thirdly, to build public support for solutions that improve affordability by creating a communications forum for the exchange of information, relevant studies, and qualitative storytelling by individuals and businesses. So please visit our website at VHC911.org. Thank you. And now let me invite to the podium Lisa Grunfeld, co-founder of OnLogic.
Good afternoon, everyone. My name is Lisa Grunfeld, and I'm the co-founder of OnLogic. I am also a South Burlington resident, and our corporate headquarters are located in South Burlington. We are an industrial computer hardware company. We design and manufacture computers for industrialized uses in rugged environments. We have nearly 200 employees in Vermont, and the remaining of our employees are in North Carolina, Europe, and Asia. We'd like to thank Governor Jim Douglas and Lisa Ventris for inviting us to be here today. I'm here to address this critical issue impacting businesses of every size here in our beautiful state, as well as the overall well-being of our communities, and that is the skyrocketing cost of healthcare in Vermont. The numbers are fairly alarming. Vermont has a dubious distinction of having the highest commercial insurance rates in the nation, more than double the national average. In just the past 7 years, the monthly cost of the most basic health insurance plans has nearly doubled, outpacing our neighboring states and the national average by a significant margin. But ultimately, at OnLogic, we'd like you all to know this isn't just about numbers on a spreadsheet. These costs have real-world consequences. They strain our businesses. They force companies to make tough decisions about salaries, benefits, and growth. They burden our schools and our towns. They impact our property taxes and the services we all rely on. They contribute to an image of Vermont as a place that is unaffordable for working families and unfriendly to business. They're making it more difficult to attract employers and also critical employees. And most importantly, these healthcare costs leave countless Vermonters uninsured or underinsured. It jeopardizes their health and their financial security. As part of the business community, OnLogic is acutely aware of these impacts. We hear firsthand from family-owned businesses that struggle, tech startups that struggle, trying to survive amidst Vermont's soaring healthcare costs. The good news is, we believe we have the tools to address this challenge. By promoting greater efficiency in our hospitals, we believe we can rein in these runaway costs without sacrificing quality of care. OnLogic wants to be very clear to our healthcare workers. We value you. We know you are dedicated professionals. We know you provide vital care to our communities. This is about taking a hard look at the systems and the policies that impact healthcare costs. We want you to know we deeply appreciate the hard work you do. We hope we can find opportunities to improve the way costs are handled and how that translates to the burden being passed on Vermonters who require care. Vermont Healthcare 911 is committed to sharing data related to healthcare costs. If you can't measure it, you can't fix it. We urge everyone to review the information available on the Coalition's website, sign the petition there if you're willing, and submit your own healthcare experiences in Vermont, and contact your legislatures to encourage action. Together, we really believe that we can build a healthier and more affordable Vermont for all of us. Thank you.
Thank you. Good afternoon. I'm Don Tenney, a high school English teacher from South Hero. Proud to serve as the elected president of Vermont-NEA. And just for the record, I was born at Mary Fletcher Hospital. Very few of you in the room can say that. But on behalf of my fellow 13,000 educators, I'm pleased to be here and eager to address the healthcare emergency all Vermonters are facing right now. Like all Vermonters, my fellow members and I pay more for healthcare and hospital services than almost anywhere in the country. Recent reports from the Green Mountain Care Board and others show that our state's major hospital system charges more for care. Costs borne by Vermont's residents, businesses, insurers, school districts, and ultimately taxpayers than their peers in New England and across the nation. Simply put, this has to stop. At a time when the state's public education system is under a microscope, it is long past time to do the same with our troubled healthcare system. We know right out of the gate there are simple reforms to our healthcare system that can save Vermonters tens and tens and tens of millions of dollars annually. We know that we have reached a crisis, a true healthcare system 911, when insurers, regulators, and everyday Vermonters are banding together and saying, enough. We know that one of the primary cost drivers in public education is the inexorable and unacceptable soaring of hospital and healthcare costs year after year after year. The collective expertise of this coalition and the broad bipartisan makeup of this team augurs well for the future. Vermonters deserve high-quality health care that is affordable, accessible, equitable, and universal. And they deserve health care that doesn't break the bank. Join us in our quest to address this pressing health care emergency. Thank you.
Good afternoon. My name is Nicole DeVita. I'm a certified ophthalmic technician at UVMMC, and I am the president of healthcare for AFT Vermont. AFT Vermont proudly represents over 6,500 healthcare workers across the state. We are all in this room today for the same reason, the healthcare crisis in Vermont. Healthcare in the state is unaffordable to many, even the healthcare workers that provide the care. Access to care has also diminished. Recently, the UVM Health Network announced cuts to essential healthcare services, such as dialysis, mental health, and primary care. This was the network's response to the Green Mountain Care Board's budgetary decisions. We cannot stand by and be complicit in the trend that when a hospital budget gets tight, the suggested remedy is to cut from the bottom, from our most vulnerable, instead of from the top. Patient care is a priority for hospital workers and this coalition. The data demonstrated here today shows that there is room to save, such as reducing excessive administrative bloat in our hospitals without hurting care, while saving Vermonters money and still having enough to invest in preventative and primary care. Thank you.
Good afternoon. My name is Bill Stritzler. I'm the managing director and owner of Smuggler's Notch Resort. If you know anything about the ski business, you know that it is a very capital intensive and human resource intensive business. And those two components make up a good deal of our management effort and management time. So 10 years ago, when I look back at our investment history, 10 years ago, we were able to invest $3 million more into Smugglers and therefore also into the local economy. At that same time, our employees and Smugglers combined expenses for healthcare was $1 million. $3 million in the business, $1 million out for healthcare. Now, if you move the clock forward 10 years, we just closed the books on this year's results. Our investment this year was $2 million. And by the way, by policy and practice, any free cash flow that we generate in a year goes back into the business. So this year, it was $2 million compared to $3 million 10 years ago. Our healthcare costs for our employees combined, Smugglers and our employees' cost of healthcare, went from $2 million during that period of time, or rather from $1 million to $2 million. So the amount of increase in costs for employees and for Smugglers was $1 million, while investment declined by $1 million. Now that's obviously not a sustainable direction to be moving in. And therefore, something has to be done. And that's the reason that I made the judgment when invited to be a part of Vermont Healthcare 911.
For closing acts, Governor Douglas. Well, thank you all for coming. I'm honored to work with my good friend Lisa Ventris to co-chair the advisory council, and I want to thank her for stepping forward, and also Chris and the members of the board of VHC911 for their leadership too, in what I believe is a critically important issue for the people of our state. I hope you agree that the graph to my right and your left is stark. Vermonters are paying twice as much for commercial health insurance as most people around the United States. And you'll see that the trend line is unfavorable. It's been going up rapidly over the last few years with showing little sign of retreat. Well, that's a big problem for the reasons that you've heard from my colleagues in terms of attracting businesses to locate or expand here, in terms of attracting employees to come to work in Vermont, and in terms of attracting more families to make this their home for years to come. Now, we have a lot of things that are good about healthcare in Vermont. The quality of our care is great. We have a low rate of uninsured compared to other places around the country. We have a focus through the Vermont Blueprint for Health on preventive care and primary care to try to keep people healthy in the first place. We talk a lot about the cost of care. The least expensive care is avoiding it, and we've done quite well in many respects there. But Vermont is becoming increasingly unaffordable for a number of reasons. Yesterday, Governor Scott outlined several of them. The property tax burden is rising. Housing is beyond the reach financially for a lot of people in our state and those who seek to be Vermonters. And the third element of this crisis of affordability is the rising cost of health care, as evidenced by the insurance rates that we are paying. So we need to tackle this now, because the demographic trend of our state is moving in the wrong direction too. We have an aging population, we have fewer and fewer kids. Our economy is threatened by that trend, and unless we can attract more families with young people to live in Vermont, I'm very, very concerned about our economic future. Now, the Green Mountain Care Board has asked good questions of hospital leaders in our state about their costs, and we encourage them to continue to do that. But this is hurting our economy. This is hurting the growth of Vermont, and we need to have all hands on board if we're going to make any progress to make it more affordable. So I hope that everyone will join together, employers, workers, policymakers, providers, ratepayers, taxpayers. We need everybody to step forth and say that this is not acceptable. And we have to find a way to bring these premium costs down, and that means bringing hospital costs down too. I think we can do it. We're Vermonters after all. We've tackled many other challenges throughout our history. And I think that working together on this, we can do our part to make Vermont an affordable place to live, work, and raise a family. Anybody want to add anything? We'll take a few questions. I'll just say thank you, everybody. I cannot remember the last time that a coalition that included CEOs, workers, unions, AARP, and this kind of diversity standing together to tackle a crisis in front of us. That is pretty special, and I hope it's not lost on all of you.